Okay. I'm Mike Freelander. I'm the chair of the I'm Mike Freelander. I'm the chair of the House of Representatives Standing Committee on Health, Aged Care and Disability. Since I came into Parliament in 2016, one of the best things that I've been involved with is with the Global Health Alliance and the work that they're doing to improve population health around the world, but particularly in our near neighbours. It's a great privilege to be here with Professor Brendan Crabb from the Global Health Alliance. I'll hand over to him to talk about their new stocktake of global health in the 21st century. Thank you. Brendan.
Thank you, Mike, and thank you for your leadership over so many years in this space. Yes, look, today we're here to launch two reports that the Global Health Alliance has commissioned, one on Australia's investment in global health research, and the other in Australia's investment in two big multilateral funds, the Global Fund for HIV, TB and Malaria, and Gavi, the Vaccine Alliance. These multilateral organisations run out of Geneva that Australia contributes to get the extra bang for your buck that sort of conglomerate allows. Look, the backstory is that global health, for sort of all its imperfections, has delivered for the world. Over the last 50 or 60 years, life expectancy has increased 30 years on average, right throughout the world. And that increase is true through low-income countries right through to high-income countries, albeit from a different base. And the reason for that is largely innovations in health, clean water, hygiene, sanitation, vaccines, and other interventions to improve maternal child health. And we've seen this spectacular increase in life expectancy, not just because of the innovations, but because they've been made available to everybody at global health, regardless of your capacity to pay or your marginalised status in society. So we're here in this space saying, from that exceptional base, where's Australia at? And the good story is Australia has made remarkable contributions in the global health space. Think Gardasil, for example, the vaccine for cervical cancer, invented here, and then Australia contributes so much to the global effort to distribute that vaccine to the world. Our COVID response, our HIV response, the last big pandemic that the world faced, truly remarkable contributions that Australia's made to Australia, but more importantly to the region and to the wider world, or just as importantly. So we've got that great legacy, but these reports say that we underinvest, pretty markedly underinvest at the moment in this space relative to our peers and relative to the challenges that are there at the moment. And the challenges are bigger than they've ever been. We've got health-related impacts of rapid changing climate and environment. Pandemic is an example of that, and the increased frequency of pandemics that will happen as a result of that. Antimicrobial resistance, the next guaranteed pandemic is antimicrobial resistance, where standard antibiotics no longer deliver the benefit that they once did. We're going to have to face these challenges, and we're going to have to face it in a world where there's the US, the major driver of the global health effort, has effectively exited the scene. So the challenge is there for Australia to increase its spending and to do it in a more targeted way, a more strategic way, and these reports effectively are the blueprint for that.
Thanks, Brendan. Good.
Can I just ask, we saw after the COVID report that trust in our medical systems and global sort of health organisations have plummeted. Is that, what role does that have in going forward and developing across the world?
Well, global health efforts largely deliver for people in desperate need, and those people are still very receptive, as a general rule, to the vaccination programs to the maternal child health programs that are being offered, to nutrition-based programs to get a healthy start to life. In our own community, trust has most definitely declined, and that's why, for example, through immunisation rates, we see this drop-off still from a very high base, but we see this drop off. So I'd say two things about the trust thing. One is in sort of pandemic peacetime, if you like, we're not in an emergency. It's a very serious issue. We have to work hard to regain the trust of the community. I'm not sure it's quite as bad as you paint it. I think scientists, for example, in general, are amongst the most trusted professionals of any profession in Australia, and that's still true. But we have to work hard at that. I think what's underappreciated is that too is a science, a social science. We value making vaccines. We don't value so much the social science of delivering those and acceptability amongst communities. I just use vaccines as one because it's a rather dramatic example at the moment.
Yeah.
The second thing I'll say is when there's an emergency, when we're punched in the nose, I can tell you people are going to want to latch on to the knowledge and solutions that the scientific world offers.
And can I just ask on the US cutting a lot of funding for foreign aid? When we look at our region, it's like vaccines for malaria, things that are vital to vulnerable communities. How can Australia step in and watch?
Can I just say Australia has done a fantastic job, particularly in the last few years, in our near neighbours. We're still very worried about some of the immunisation rates in places like PNG, where childhood immunisation rates have dropped under 50% compared to Australia's, which is in the mid 90%. So Australia has done a great job in trying to educate people about the importance of immunisation and public health measures. But we are facing some headwinds, particularly from places like the United States, where RFK is leading the misinformation charge. But the Global Health Alliance, working with Australia, has done a fantastic job in our new neighbours and will continue to do so. And the Australian government has been incredibly supportive of this. The problem is there's a lot more to be done, and we are facing those headwinds of misinformation.
And I guess the short story of dealing with the US pullout, I mean, it's a major shock to the system with immediate ramifications for people who can't get their antiretroviral therapies, don't get their insecticide-treated bed nets, and so on and so forth. And, of course, it's a more medium to longer-term major challenge for the world. It's not turning around in a hurry. So the premise of the question is an absolutely right one. Look, the first thing Australia can do is really quite markedly improve its investment. I'm sorry to say that in front of Mike, but the capacity is there in research, for example, through the Medical Research Future Fund. We have this $24 billion fund, of which global health is a priority for it, and it's only dispersing $650 million a year. It was announced, I was there at the announcement, as a $1 billion a year scheme. So clearly there's a mechanism there to give more to global health research. We, on the foreign aid front, we're well below our peers in how much foreign aid we give. So the short story is that both from a funding point of view and from an alliance and partnership point of view, we have to do more and do it differently. Work with our partners. In this case, it'll be non-US partners, but there is a big rest of the world there who's got too reliant on the US, frankly, and we can all collectively step up and turn this around. But it's a major, major challenge.
Thank you. Good.